Hi there, everyone. I'm delighted to be here. My name is Katie Esseene Deevy. I am a general practice nurse, and with my colleague, Dr. Erica Murphy, we're delighted to present our feeling on social prescribing in Irish general practice. So just about us, we're a very small medical practice based in South Dublin. We have approximately 2,000 patients. About 800 of these we actually have only taken on recently, just with a retiring GP nearby. So we have a very diverse group, which is brilliant. We've about 6 staff members as well. We've 3 receptionists, 2 GPs, and a GP practice nurse with as myself. And what we found is that we've had a huge rise in complex presentations in the last few months. This is particularly can be anything from number of different complaints or complaining of different things like social isolation, high blood pressure, noted chest pain, dermatology conditions. And I suppose a lot of that has come from COVID and moving outside from the restrictions easing. We're seeing huge demand for service. But I suppose one of the biggest things we're seeing at the moment is loneliness and social isolation. So we know this is a huge issue for our social determinants of health. And I suppose the World Health Organization has recognized that the effect of this on mortality is actually comparable to smoking, obesity, and physical activities, those big risk factors that we're always concerned about. So much so that the UN have recognized it as a primary health priority for age action. We're seeing it across the board from younger people to older people, but particularly seeing a massive rise in presentation that we are linking to COVID pandemic measures, from people who are cocooning, and even with the easing of restrictions, still slowly finding it very difficult to return to pre-pandemic activity levels and social interactions. The big issue we have is that we're finding that there is limited resources on our side in general practice. There is an element of us saying, well, would you get involved in church? What are you interested in? But the barriers to that is we don't know who to contact, how to get involved, where you can locate the services, how often is it on. So that's when actually social prescribing comes into play. So social prescribing it's a framework that's been run in by the HSE under Healthy Ireland in 2019. And it's a fantastic service. It's not very well known yet. So we're really lucky to have found it. It's a local community intervention. It's not nationwide yet. It is available in about 30 locations. And it's an initiative to meet the gap in social exclusion for various issues. So not only just social isolation cases, but it helps in treating things like managing chronic disease, such as getting involved in more exercise in terms of walking groups, if that's what you like, or getting involved in swimming or different areas like that. Whatever you're interested in, they'll find a group for you for that. Also with mental health presentations and support groups like Alcoholics Anonymous, helping with mother and baby groups as well. And also acute social issues. We've referred patients who have left domestic abusive relationships and trying to increase awareness in the activity. So that's all good, but how does it work? So I suppose what myself and Dr. Murphy decided that we would introduce a question into our chronic disease program screenings, where we would say, how do you find your social life these days? So kind of, still talking about all of our, how are your vaccinations up to date? How are you managing your health? But mentioning your social life, because we've seen such a high noted interest in this. So what we did is we located our local social prescribing group, which we thankfully have one in our area, and we are set up on their e-referral service. So what happens is that once we find someone suitable for the service, I will refer them to our local prescribers, and they have a link worker assigned to them. Then that link worker will call the patient, and just explain the service, consent with them, and then they'll organise a one-to-one meetup where the link worker and the patient will meet up to discuss what they're looking for. So if it's exercise, what kind of exercise? If it's getting involved in the community, to improve social inclusion. Okay, well, what things do you like? Do you like gardening? Do you like to be involved in the local GAA group or knitting or artwork? So they have a plethora, a phone book of community activities and courses and groups. They have all the contact numbers and all the ways into it, so they can support the patient in getting involved, something that suits them. And it's all around them, and it's a mutual consent to what they want to be referred to, and they see how they get on. So there's about a 12-week or so relationship with these link workers, seeing how they are, and at the end of that time they see, well, look, are you happy enough with your program? Are you happy enough with the things you've done? And if they are, they finish their time in the social prescribing program, and then they can come back at any time if they want to. If they say, you know what, I tried a couple of courses, I want to do something else, and then they continue on. So there's a full support there. The link workers have a direct linkage with us in GP. So if there's any cause for concern or any need for GP referrals, we're able to facilitate that to help the patient. So activities, like I said, they range from, volunteering to meditation to counseling groups to cooking courses mentioned. There's so many. It's a fantastic service. So the results of how we implement into our practice is that, we had about 30% waiting contact to start the program, which is quite, not ideal. We'd love to get more people involved quicker, but there are issues in terms of resources, sadly. There are 30% who actually declined to participate. Some people decided they wanted to think about it. Some people weren't ready yet, and some people didn't think they'd have enough time, so they declined once the link worker rang them. And then 40% are engaged in the process, and those that are engaged have said satisfaction across the board. We haven't had anyone who was dissatisfied with the service, which is lovely. Improved social inclusion in groups in the community, which is brilliant for improving community spirit as well. Educational benefits as well have been fantastic. There's lifelong skills that are involved in this too, which is brilliant. In terms of doing courses where they can continue and use their developed skills further. One patient, we had a weight loss of 5%, and this person in particular has multiple comorbidities. So we know that a weight loss of 5-10% is really brilliant for managing health conditions in those with elevated BMIs or with comorbidities. So it's, life-changing long-term results as well, which is fantastic. Anecdotal improved mood from patients and improved kind of skills to manage their own chronic diseases, which is fantastic. When we looked at our reasons for referral, about over half of them really were for social inclusion. 25% of them were for exercise and different exercise groups. So this has been great actually in terms of our non-communicable diseases and improving those things like exercise to get more involved. Instead of saying, well, 15 minutes or 20 minutes, 30 minutes, try as much as you can a day of walking, we can say, well, what do you like to do? What did you like to do when you're younger? And it's kind of getting people involved and like linked up to those services again. 15% was loneliness. And so just they had good support, good relationships in the area, but they still felt lonely. One patient had said, all my friends are dead, which is horrendous to hear. So be able to link them into age groups with their own has been absolutely brilliant. And then we have 5% referred to mother and baby supports and mother and baby groups, which they found really helpful. So these are quotes from some of our patients. It gives me the push I need to get out of the house. I can notice a change in myself and I'm talking to people again. And this is a gentleman who hadn't left the house in 2 years, apart from, going to the shop or going to the GP after his wife died. So it was really great to get feedback, and I feel great. I finally feel like myself again. That was a lady who had been very active pre-COVID and was really struggling to get back to it after, restrictions had eased somewhat. So there is really good results there. In terms of our lessons learned, social prescribing, it is cost effective. It's a collaborative solution with another group to patient health and well-being. And it's great for us to be able to refer on and increase activity in the community. So there's a huge multifold benefit there. Social prescribing can improve mental and physical health with this kind of broad comprehensive program, something for everyone. And there can be both acute and long-term benefits. So we are seeing most of the acute now. We're going to hopefully, observe to see how much these long-term benefits are there. But with these educational groups and the likes of mindfulness, we are instilling, long-term skills that can be used to manage things like anxiety and other conditions. So there are benefits to it long-term. More funding is unfortunately needed to improve wait times. Like that's absolutely, we can see that at the moment. But, in a global health solution, like, is this a viable global health solution? Absolutely. So this social prescribing really reminds me of the friendship benches that started in Zimbabwe, and I think it's a really good community interactive groups. So it is community based, it is accessible through your GP, which I'm sure there is a slight barrier there. If you're not going to your GP, it's not totally accessible, but it is in that regard, and we can flag people in our community that way. It is possible to duplicate, and most of all, I think it's a very holistic and person-centered approach to care, which I think is needed now more than ever, really. So the next steps for us, we want to increase awareness of the service to patient practices. So primarily we've been doing this through our chronic disease program, and then, opportunistically with other consultations that we'd have. But we really want to increase the awareness to everyone as much as we can in all of our patients. So hopefully creating things like posters and patient information leaflets that are accessible, possibility of med cafes, multiple different ways to raise that awareness, and also to other practices, because it isn't as broad spread at the moment. And hopefully by increasing the demand and increasing the patient access, we can increase the funding as well, and the need for such a great measure. We're going to continue to follow our patient progress and hopefully develop a more in-depth study. And then, absolutely advocate for more funding for services nationwide for everyone to get involved in. So thank you so much for listening. I've added some links there just to learn more about social scribing, find it in your area, and an in-depth video to what it's all about. But I'd love to answer any questions that anyone has. And yeah, thanks for listening.